Welcome back, all of our viewers and followers. Today we have a special and exciting session with a Dr. Shiller, and we're here to get broadcasted with Dr. Shiller, and he's going to focus today on general wellness, specifically under these conditions, and even beyond that, broader than the conditions of the coronavirus and the social distancing and so on. Before we get going into the details of that, Dr. Shiller, can you give us a little intro or a little bit about your life and what brought you to this, to the stage of life where you're able to offer such advice and in general wellness?
Sure. So you introduced me as Dr. Shiller, and my background is that I went to medical school, and I studied at Duke University and then went and did a double residency at Harvard Medical School. And my training was a combination of internal medicine or general internal medicine and what we call physical medicine and rehabilitation, which is physiatry or rehab medicine. And so the focus of what I did in the early part of my career was really about meeting people who have been through some sort of catastrophe, whether it was a spinal cord injury or stroke or massive trauma or brain injury or an illness like multiple sclerosis or other acute medical illness where someone was really sick. And then after that, they go to rehab to kind of get their life back together. And maybe they need to learn how to walk. Maybe they have chronic pain, learn how to function again as a human being and pick up the pieces and go on with life. And so we learn a lot about muscles, bones, joints, nerves, the function of the whole body, how all the medical systems interact with the movement system and the ability to function in the world. And my own experiences back then were, I think, as an introspective and thoughtful person, I was asking a lot about well, what kind of person gets better and what kind of person doesn't get better, right? The medical diagnosis is only one aspect of the picture, but I can distinctly remember seeing two guys coming at the same time, suddenly paralyzed from the waist down by a horrible accident. One of them has a horrible course where he spirals into depression and misery and drug dependence. And the other one has this horrible traumatic experience and somehow grabs on to life and faith and intention in a way that he actually grows and he evolves. And in modern medicine, we have a construct now they call post-traumatic growth, right? And so this is the guy who had this horrible thing happen, and instead of becoming miserable for it, he actually became a bigger person because of it. He actually went through a transformation, and it had a positive impact on his relationships and how he understood himself and how he understood life. He became a counselor working with people who were having horrible injuries and accidents and really became a shining light in the world. So I got fascinated with that question of two people, both in horrible circumstances. One rises out of it and shines, and the other one really kind of goes downhill. And that's actually part of what catalyzed my return to Judaism, because I didn't grow up a religious person. And that's part of what triggered my own spiritual search, was seeing these kinds of things happening.
Well, that's
interesting. I wasn't expecting that to come out, but sorry, whatever.
That was great.
So
it was very nice. I mean,
I'll jump back in now and get more normal. And so in this background of working with a lot of people in different kinds of crises, it was very clear that there is a sort of medical view, which is about the illness and the sickness and what's wrong with the person. And there's a wellness view, which is about, well, what can actually empower and enable this person to live the best life possible. And in the world of rehab, that's what we're focused on. And we work with a whole interdisciplinary team of different kinds of therapists and practitioners. And it's a very different question. It's not what's wrong with you, why you're sick. It's what's right with you. What are your assets and resources? What can you build on to actually strengthen yourself and connect to life in the most meaningful way possible? So with that sort of training that was a biomedical, standard, conventional academic medicine background, I also was seeing a lot of people where, modern medicine's magic bullets couldn't fix their paralysis and it couldn't fix their chronic pain. So I started studying other systems of healing. And I studied a lot of mind-body medicine. I'd already had a lot of experience already with meditation and movement arts like Tai Chi and yoga. And I learned a lot about those things, and I started to bring those to my patient care. And then from there, also started learning about nutrition and mindset and other aspects of lifestyle that have a significant impact on a person's sense of well-being. So there's
Yeah,
wellness.
that makes sense.
Yeah.
Beautiful. Sounds like you've taken a bunch of, like, it's kind of like me as a Baal Tshuva. Like I try to take a little bit from everywhere, all the good stuff, you know? So it sounds like you've done that in the medical mindfulness arena, like just
Yeah,
put
it
it all
seems
together to help people
right,
in
right.
a different way.
Yeah, and so I think you've got it right on. And to me, it's about trying to bring the most complete view possible to the picture when someone's sitting
Realistic.
in front of me, and like, who is this person and what do they need, not only as a body who might have medical problems, but as a soul who has needs and desires and aspirations. And there I am sitting in the breach with them. And it's not that I'm trying to be their psychologist, but as their doctor, I can recognize the integrative aspect of the whole person. And, we have a really clear tradition in Torah that a human being is not just a body and it's not just a soul, and these aren't two separate things, but that there's a bodily soul and there's a more elevated soul. There's nefesh, ruach, and neshama. There's the elevated sort of intellectual soul. And that seems to me kind of mapping on to what we see in modern conventional medicine, where it has embraced a more holistic approach, where they talk about body, emotion, mind, sometimes spirit. And we have a map of that. All of that's integrated. It's one thing. And if you look at the actual medical science that's been sort of developing and building over the past, I think, 30 or 40 years at this point, we're seeing an incredibly rich integration of these aspects that we might have called mind and these aspects that we might have called body. And so what we're seeing is, rather than this sort of separate view that used to dominate Western culture, what we're seeing is a view that sort of matches more clearly with the way the sages understand reality, that everything is integrated. And, we could talk about more scientific stuff at some point if you want, but just the basic idea about how various states of mind affect the health, whether it's stress or gratitude or generosity or despair versus having a sense of control. These are things that behavioral sciences have learned to measure, and that we're starting to see correlated with all sorts of different health outcomes. So there's both a kind of common sense view that says, yeah, how their outlook is and how they feel about things has a big impact on their health. And then there's a scientific view that says, well, yeah, we've been measuring it and common sense seems like it's right. And guess what? It matches with what the sages say.
Hmm.
Wow. Would you say, as a pointed question, is like, after you've listening to the history and what you developed into in terms of your focus and the all or wholesome, all inclusive package of how to perhaps help people or work with people or bring out the good points of people, would you say, I guess a twofold question. One, that here we are across the world, all types of people experiencing change. Doesn't mean change is bad. It can be very positive, but there's a lot of change. A good portion of it stressful. A good portion of it we just are not sure how to deal with. Is there a way, like general wellness, like a good way or tools for people to embrace their new life, or even if their life hasn't changed, to improve the life they have without being that example, God forbid, of a cripple who, thank God, was able to look at the positive? I'm saying now where you have someone who's not crippled, they're normal, but they can perhaps get advancements in their job, find a new job, open a business,
Right.
call them bias,
Sure.
so on.
Yeah. Great question. So it sounds like what you're asking is, okay, we've talked about this notion of the integration of a human being in the context of someone who's had a catastrophe and become really injured or disabled. What about in the context of someone who hasn't had that catastrophe, who's either wanting to just live a better life, or someone who's under stressful circumstances? And the answer is the same issues apply and the same principles apply. And I think what I would add to the picture is that adversity can either bring out the best of us or it can bring out the worst of us. And change can be stressful. Change is one of the most stressful things we know. And adversity is what we're all experiencing in the spring of 2020, because there's been so much change all over the world. We have a worldwide shift in reality, and we don't know how it's going to go. You know, we're just kind of starting this whole process of what is coronavirus and what's it doing to our society and our families and our jobs and our function as human beings. And so it's adversity for sure. And the question is, do we embrace the adversity and draw on tools and techniques to empower ourselves to be the best people we can? Or do we just sort of like binge on Netflix all day long? So, and I'm sure you can see what my advice, suggestion, inclination is let's get out the toolbox. You know, it's a hard situation. Rally the troops, everybody. What are we going to do? And what I would say about that is that in my eyes, there's kind of three main domains of how a person can bring themselves to higher functioning and wellness. And I call it the 3 M's, and I use this in my practice just to sort of help people keep a broad perspective, right? Because, for instance, the 3 M's, as I name it, you know, there's a lot of ways to think about a human being, but we've got kind of the aspect of our mind and mental and spiritual functioning. We got the aspect of our mechanical structural movement system, right? Like how we get around. We've got the aspect of our metabolic or biochemical system, all the chemical reactions in the body, the food we eat and all of that. All of these are completely interconnected with each other. That's what the science of integration and modern systems biology tells us, is that everything's integrated. And they all have an influence on each other, and everybody's got an inclination about what they're most inclined to, about what they're most interested in doing. And I work a lot with people around mind-body training, which is about developing certain aspects of mindset and outlook and intentionally cultivating certain frames of mind that allow a person to be more resilient and mentally work better with stress and change and difficulty, conflict, failure, things like that. Resilience is the word. It's like, if I take this glass and I drop it on the floor, it might shatter. Not very resilient. If I take something that's high density plastic, it's going to bounce. Resilience is bouncing. Like, do you bounce back when hard stuff happens? That's what resilience is about. And there are mind-body techniques for teaching resilience. And so simple relaxation techniques, visual imagery, mindfulness training. And there are also spiritual techniques. There are meditations that are actually built into the teachings of the sages of the Torah tradition that are about building the capacity of a human being to not only handle adversity, but also rise to a higher level of what it is to be a person, and to develop the personal qualities that allow us to be responsible, loving, giving people of integrity, even though we're under stressors that might otherwise cause us to express our more negative aspects of our nature, our more base nature. So that's just the mind-body stuff.
Well, when you speak, I want to ask you, Doc, what should I call you? Doctor, whatever you're comfortable with.
How about David or Andrew David? How about David? Most people
David. Okay, I don't want it, whatever you're comfortable with. So, David, it is definitely, correct me if I'm wrong, but I'm very intrigued by a lot of things you're saying, because at least the way I grew up, and I love my parents, get along with the whole family very well. And just through the news and the surroundings, I often, even as you're speaking, I'm saying this is like a little bit of a shock to me, because I'm saying to myself, I always looked at my failures or my not being so resilient to change as I've got some sort of a medical condition, or I'm broken. Can you give me a medicine? Could you bandage me up? Is there any doctor I can go to fix the broken thing in me?
Right.
But when I hear you speak, I almost hear it's like, it's not a matter of broken. It's like undeveloped muscles that are like, we've got great character traits, faculties, capabilities, and we're just taught to seek out, like, we're missing, we're broken. You know what I'm saying? We just need medicine to because, or we'll never be able to operate well. I just failed too many times. I must just be incomplete. You know, so, but it sounds opposite. That sounds like, you know, after practicing and you've helped a lot of people, you've noticed that a person has the capabilities, but they haven't yet built the muscle to apply or focus. I'm not clear, you know, exactly how to phrase it. Does it make sense, or can you expand on that? Am I right? I don't know.
Sure, I think it makes very good sense, and I'm really glad you brought out that point and brought it into the light. And you know, again, there's by and large, what I learned to do in medical school and residency training is figure out what's wrong with people. And medicine is basically a diagnose the problem orientation. That's what we get trained to do. And a lot of our modern culture is around what's the problem? What's wrong with him? What's wrong with her? And modern psychology also developed along those lines, because modern psychology developed in the shadow of medicine. And it's really a question of, well, what's the diagnosis and what the liabilities and what do we need to do? And that's definitely not the approach that to me seems most productive and helpful for people. For sure, we need to diagnose things sometimes, right? When I see somebody who has, say, anxiety or chronic pain, part of my mind is wondering, okay, is there a really bad anxiety disorder? Could this person be suicidal? Could there be other mental illness? Could there be substance abuse? Could there be things that are bad things? But equally important is, well, what does this person really care about? What positive events have they had in their life? Have they had positive role models? What strengths do they have? Because that's how a person pulls themselves out of difficulty, is on their strength. And I think we have a very strong, I wouldn't say Masorah, but there's so many Masorot in the Torah tradition, whether you're looking at the Bali Musar or the Bali Hasidus, or probably a lot of the Sephardi Rabbanim and sages that I'm less familiar with just because I'm different background. But there are these inyanim of how do we take the person's natural strength and the fact that the person is connected to Hashem, connected to God, and has this holy soul, and help them grab onto that. And on a certain level, we could get confused in either direction, right? A person could be confused by thinking, well, I'll just focus on the positive and not realize that there's something dangerous that they might need to guard against. But equally dangerous is to focus on what's wrong without focusing on actually the strength and the positivity and the opportunity. And that's actually also expressing itself in mainstream healthcare. There's a whole movement called positive psychology. And in positive psychology, a lot of therapists are learning that. They're learning to, how do I evoke the natural intelligence and resilience and healing capacity that lives within inside this person? And you know, in my view, there's various techniques that are being brought into modern medicine. One that people like to talk about is kind of meditation and mindfulness. And what are we really doing in meditation and mindfulness? Just to sort of describe the process, part of it is creating relaxation and doing various mental and physical focusing and concentration that evokes a kind of turning down of the stress response, which is a whole set of physiologic changes. It's worth talking about that at some point. So your viewers could understand what that really means and start to see how it might be real for them. But turning down that stress response, which evokes the relaxation response. And the relaxation response is part of what enables our body to heal and recover. And that's one initial step into other practices. And there's a practice that's called mindfulness training, which is really about training awareness. And we all have awareness. Most of us are not necessarily aware that we have awareness until we start paying attention on purpose. And mindfulness training is about paying attention on purpose in a structured way to start to get more clear about what's really going on, and to create kind of a more expansive awareness that can hold the challenges and the positive stuff all together. And there's layers and layers to it. Um, it's one thing to talk about it, another thing to actually experience it. So, yeah.
Does it have, I mean, you've hinted it, or you said we can get into it one day or one time. I see that, I guess the direct question is, does it have medical backing that if you apply whatever mindfulness is, which we'll get to, I guess, um, that person can change? I mean, there, like, let's say a person thinks like I've always thought, and when I'm looking at a kid, I'm looking at a friend, I'm looking at myself. It's like always diagnosing the issue, but like, is it medically, like if someone has they're feeling very stressed, they're anxious all the time, that if they apply such a thing instead of medicine, this is not just the heebie-jeebies, there's something very real about it? Is it just stay positive, like, come on, the glass is half full, and that,
Right.
you know what I'm saying? People say that, but is it really now, is it embraced by the medical world?
Yeah. So I think the answer is like anything else, depends which part of the medical world, right? And so I think to answer any question about like, well, is this proven? You have to understand how science works a little bit, and the fact that science isn't perfect. There are tools in science to measure, like, okay, I've got two groups, and one group does a meditation practice, and the other one doesn't. And we look at how they compare when they come out of it. And we look at those groups with certain statistical tools and math that sometimes helps us see clearly what's happening, and sometimes kind of confuses it and confounds it. Um, it's really complex to measure things and control all of the variables so that we know that we're making a valid comparison. And that's especially true when you're talking about meditation, because someone could close their eyes and be thinking about how much they hate their mother-in-law, and not really doing the meditation. You don't really know it from the outside unless you got them in a brain scanner or you're measuring their heart rate and their various other physiologic measures. But so let's take a step back. So that's like clinically, how do you really prove a difference? The simple answer is that there is growing research looking at various kinds of mindfulness and related interventions. You could call it mind-body interventions or mind-body training, and showing significant impact in terms of quality of life, in terms of the way the immune system is functioning, in terms of pain and how people are dealing with it, and a lot of other measures. There's places where people are doing research in mindfulness training in education and business, and seeing the impact on how well people learn and how well people are able to adapt to difficult circumstances and to think creatively. Starting around the 1970s is really the birth of modern mind-body medicine. And there was a famous Dr. Herb Benson, who was at Harvard Medical School, who was studying this phenomenon of white coat hypertension, which is where a person like has normal blood pressure, but then they go see the doctor and their blood pressure goes up. And, we've known for generations that there is this thing called the sympathetic nervous system, or the stress response. And that affects things like heart rate and blood pressure and respiratory rate. But we've also learned over the decades that it affects immune functioning, it affects sleep, it affects muscle tone, it affects digestive functioning and bladder functioning. It affects everything in the body. And we've actually worked out that there's real wiring where that sympathetic fight or flight, get up and go stress response is wired into your whole body. And we've also seen and learned that the relaxation response, which gets called rest and digest, or the parasympathetic response, is also wired into the whole body, and they're meant to balance each other. You live a busy, stressful day, you do things, you got to run, and you can't live without stress. But then the question is, do you come back to baseline? You come back to a place of calm where your system's able to do rest and digest. You sit down and have a nice meal. You're with people you care about. You feel calm and cool, and everything's okay. The trouble is with chronic stress is that instead of stress and then relaxation, you get building up of stress over time. And we often habituate to stress. My experience with a lot of people, I mean, I've been doing these like free groups during this COVID pandemic just to like give people some tools, right? And the number of people who come in and said, wow, I thought I was pretty cool. But then I did this meditation and I realized how stressed I was.
Well,
And now I feel really good, because we tend to habituate to it because we want to just live and function and do things. But meanwhile, the physiology of stress can be sort of setting into our bodily physiologic responses.
it's like
So,
deep in there. You don't even realize that it's there. It's
yeah,
just, you
for
feel like
sure.
you're functioning and everything is just fine, but then you start really digging in and seeing like, hold on one second, I got what to work on.
Right. Like, oh my gosh, all of a sudden my shoulders are so tight and my neck hurts. Well, it's not all of a sudden. It's been going on for hours or days. You're just starting to notice it now.
Mm.
And so, part of what a person frequently learns when they start to do various kinds of mind-body training is, first of all, wow, this is what relaxation feels like. And then they start to say things like, gosh, I'm sleeping better than I was. And sometimes they might say, I'm a little less irritable with my kids.
Yeah.
And there's layers and layers to it. You mentioned, Melech, this notion of like, well, I always just learn to pay attention to what's wrong with me and what's wrong with other people. And part of one of the foundational techniques in mindfulness training is really learning to pay attention with what we would call awareness and compassion. And it's not about judgment. It's judgment-free awareness, which is something that a lot of us aren't familiar with, because most of us are very conditioned that as soon as we have a stimulus, we're already analyzing it, right? And we're already categorizing it. We're saying good, bad, hot, cold, pleasant, unpleasant. And that's happening unconsciously, like, I don't know how many times a second, but a lot. And so, somebody walks into the room and we don't like them. Well, why don't I like them? I don't know. I just don't like them. Stuff went on. They reminded you of something got triggered.
Mm-hmm.
And so part of what happens in mindfulness is learning to just see that and just get over it. Not in a get over it, bang myself in the head way, but more like see those patterns and just forgive. And it doesn't mean you become a schmata or a door or a floor mat and everyone walks over you. What it means, though, is that you're a little bit less trapped inside automatic thinking and autopilot reactivity. One of the more touching things I heard in the past year was from one of my clients who has a really challenging chronic pain syndrome with a lot of complex medical illness, who's really a warrior in terms of healing herself, and has really gone down the road of wellness and healing in an impressive way, and is much better off now as a result. Thank goodness. Thank God. And when I do like a sort of intensive course for 6 or 8 weeks long, teaching these various mind-body techniques. And at the end of it, I was asking her, well, what was one of the biggest benefits you got? And she kind of looked with this smile, which was a little bit of sadness. And she said, I'm starting to like myself again. Like she's starting to appreciate who she is. She's a really good person, loving, sweet, intelligent, giving, but like been walking around with so much self-judgment. And along with that, I'm starting to like myself again. She's more relaxed and she has less pain and she's sleeping better. She's got more energy. She's able to do stuff. And it's incredibly powerful to see what happens for people who actually give themselves over and really start learning these things.
Well, while you were speaking, just one thing that I don't know if the word's correction or to make more clear. When I would look at myself or others, I was more pointing at, I would diagnose myself or the thing. I don't mean misjudgment, oh, that person's a bad person. I mean, it must be I'm doing that so often, or that person's doing it, so they must have whatever they call it, ADHD. Everybody's got a title now. And so like to fix that, just go get that medication, or you better go see a doctor. And part of that, as a real life example for, let's say, business. For years being in business management, development, or sales, I can only speak from my experience, not others, but I saw over and over who were some of the best result-oriented, successful salespeople. Besides all the skills and art of doing it, there was one thing and that was stood out above the rest, which I definitely struggle with and had to work on. That is, when you first get on the phone and you're going to make 100 phone calls that day or 30 visits, the first few, you're really good. That person's really good. The problem is they got rejected 5 times out of the 6. And the thing is that may be very normal in the industry. It's a numbers game. You may have to call 100 people and you close 3 deals, and then you do it again the next day, or maybe it's 1, and that's right. So now what happens is, though, after phone call 5, 6, 7, all of a sudden, instead of saying, "Good morning, how are you? My name is, I'm here to call, just got there," you're like, "Hello?"
Right.
Just wondering. All right, no, you're not interested. All right. So have a good day. Just have a good day. You don't want to get rejected. It's so, and then you start, I would see people all around me. I'm a failure. There must be something wrong with me. And it's a diagnosis right away. It's right away that I must have like a fear issue. Let me go to fear groups. Let me go for a fear group and get medication for that.
Right. I hear.
So anyway, that was part of it. And I'd love to hear more about it. I mean, I'm going to have to eventually myself come to a close, but this is an unbelievable session.
Beginning.
The beginning. I mean, there's so much more to speak about. I think that this would be, if you're up to it, one of a few other sessions to go through step by step, how it really helps,
Sure.
Why it would make someone's life better. Some of that you've explained, but I guess either experiencing it, more examples of,
right.
I'm feeling that experience. Why would it help me? If I was a salesperson in that scenario and I knew how to apply some of this mind-body therapy, or whatever we call this practice, exercise, what would change? Why would it change? Right? I got many pep talks. Why would it change?
Should I try to answer that right now in like 30 seconds?
Yes, but I'd love to hear your real expansive step-by-step in session number 2.
All right. So the brief answer is, because if you have a tool that allows you to come back into the present moment and connect to your heart and connect to joy and connect to your intention in making that next phone call, then it's fresh and it's new. It's a practice that's about, to put it in sort of Avodas Hashem language, it's about bittul. It's like, okay, stop all that. All those things that happen, the way my mind's working, stop, come back to the here and now. Feel my breathing, feel my body. Maybe I want to connect to a sense of godliness, however I know it, and that brings me here and now. And let me connect to the potential in my own soul, or koach hanefesh, that I have right now, and show up. And the guy who makes the sale in your model is the guy who shows up, because the person that their line's like, wow, he was so nice. He was so present. He was empathic. He heard what I was saying and thinking, and he was able to relate to it and respond to it in a meaningful way. He was there with me. That's the guy that we all love. And we can all be that guy. That's the husband who's a great husband. That's the wife who's a great wife, and the parents who are great parents, because they know how to reset, to plug back into their resources and their strength and their clarity and be their best self now and now. And like, yeah, you got to take a vacation sometimes, and you got to go to sleep sometimes, and sometimes you got to go to the gym, and, but as another, just sort of in closing things, it sounds like we're out of time for today, but, we started to open up the mind body part of all of this. But let's just also remember that there's also the movement structure part of us, right? Because physical movement and exercise has a profound impact on physiology, on learning, on sleep, on memory, on all sorts of aspects of how well a person can function. Just from doing exercise. Go to the gym for half an hour a day, in your home, in whatever context. That has a powerful impact on health. And the same thing with what we eat and what we put into our mind and what we put into our body. And again, we've got growing research. Again, nutrition science is hard because it's all relying on self-report and, do they really eat exactly that? And which kind of bread was it? And all these questions that's hard to define and quantify scientifically. But there's growing research, and a lot of it talking about how diet has such an impact on mental functioning, developing of chronic illnesses like Alzheimer's and Parkinson's and how diet and the overall functioning of our gastrointestinal tract, or our digestive tract, has an impact on things like depression and ADHD and mental health in general, and for sure physical health and inflammatory illnesses. Every specialty journal or specialty, like neurologists have certain journals, and so do endocrinologists and orthopedic surgeons. Wherever you look in all of the ologies, you start to see how diet and intestinal health has an impact on the chronic problems in those ologies that those ologists take care of. And so what we see from that is that these are really important factors in wellness, in functioning, in to what degree am I living my fullest life. And especially in times of stress and adversity, where so many of us are triggered during adversity to eat in ways that are the opposite of what we're finding is healthful eating, right? Like, what's comfort food? I had a long day. I just want to like eat some fries and drink a beer, or eat a bunch of like carbohydrates, spaghetti. Comfort food tends to be kind of like sugary, high carbohydrate, simple stuff that we know tends to contribute to chronic inflammation and make a person sick. So,
Okay.
Well, we have a lot to talk about.
yeah, potentially, if you want,
We want. This was amazing.
Okay.
So when
how do people get a hold of you, first of all? I mean, before we
how do people
wrap
get a hold
up?
of me?
I mean, it sounds like this is something, especially during this time, you're doing online, right? I mean, you're not meeting people in person.
So what I do online is I see people who have got various kinds of physical and mental challenges, because people usually come to me because they have a problem, right? So for sure, people who have chronic pain, but also people with chronic inflammatory illnesses. And people, a lot more people lately are reaching out who have stress and anxiety and depression. And so I have a website, and people reach out and they make a virtual visit. I'm in the process of developing some educational programming for people who either just are wanting to live at a higher level, or dealing with an actual physical or sort of mental health issue, and want to do it along the lines of wellness and healing, and not just with medications. And to be clear, the way I practice and the way I think is not either or. It's not just about, hey, do all the natural stuff and you'll be fine. Sometimes people are sick. Sometimes a person comes to me, whether it's online or in person, and they say, hey, I've got rheumatoid arthritis and I want to get better through, the way I eat and mind-body healing. And what I see is that they've got like active inflammation in their joints, and like, that's not the time to do only the natural thing, right? Somebody comes to me and they're like, I've got all this back pain running down my leg, and sometimes they've got a problem in their spine and they need an MRI. It's like,
right.
So I try to.
That was a question I was thinking about while you were talking. If are we throwing medicine and all that out the window, or?
I know some people are, but I'm not. I believe that
okay,
modern conventional medicine and all the training I did
has
is
its place.
Tremendous value. It's first, make sure there's nothing bad going on, and if there is, address it in the most expedient way. If I see someone, again, this isn't a virtual thing, but if somebody comes to my office who's, not long ago, I saw someone who was 82 and all of a sudden had a flare up of inflammation in her knee and couldn't walk. This is someone who's usually walking around and was suddenly in a wheelchair for like 2 weeks. And an 82-year-old person who's not walking, they decline really quickly. And so this wasn't a job for, diet and mind body. This was a job for an injection in the joint to reduce the inflammation now, so she could get back up on her feet. And then if she wants to do things to strengthen her legs and eat the right food, great, let's do that later. But let's get you walking again. If you have an acute problem, let's get it treated so that you don't get sicker and have something, God forbid, bad happen. But then for sure, all of that held in a context of, okay, what are your resources? Who are you? How can we help you be more healthy?
Okay, great. So I'm going to post, you'll give me the website afterwards. I'll post it in the link.
Great. Yeah.
The video upload. And you'll find you on LinkedIn as well. You're on LinkedIn?
Yes, I'm on LinkedIn and www.drshiller.com. DRSHILLER.
Easy enough. Melech, you got any closing statements?
No, I think that was amazing, and we'll prepare for our continuing or round number 2, I guess, for continued education and how to apply it and other ideas. Especially now, we've made 3 things: mind, body, solutions, diets, and what was the third thing? And physical, right? Physical movement.
Yeah. Good.
So we can go through how they interconnect and how to balance that maybe in life and whatever else you have in mind. David.
Great.
Amazing. Thank you for your time. Really appreciate
Sure.
it.
Amazing.
Nice to speak with you guys. Nice to see you both again.
You too.
Likewise. Be well.
Be well. Hatzlacha with everything. Feel good.
You too.
Take care.